Metastatic breast cancer that has gone into the bone. What's it all about? And sclerosis in the bone. I have bone tumors and I have sclerosis. Not to be confused with multiple sclerosis, which I also have, which makes it, will admit, very confusing. So what now? You might say it's a real pain in the ass, and you'd be right. My metastatic breast cancer tumors that have gone into my sacrum, my lower back, pelvic area, and they're confusing. They're confusing for my oncologist because they're not doing the things that they should be doing as far as growing and spreading fairly rapidly. So now on top of the bone tumors, my multiple sclerosis, the cancer, I also have to deal now with the sclerosis of the bone. So I'll explain in the video because it might shed some light on a few of you who are having lower back pains and can't explain it except for the fact that you're getting older. Hi, I'm Denise and welcome to Travels in My Chair. Most of you that are subscribing to me know my journey with breast cancer, my journey with the secondary breast cancer, and what my oncologist is doing to help. And that is, I take letrozole daily, and I take a course of palbociclib or Ibrance, which is 21 days on, 14 days off. Every 3 months I get pomegranate, which is a bone infusion, and I take supplements, and I'm very careful that I don't fall, right? Because with the bones having the tumors and also the sclerosis, they're very brittle. Because of my type 2 diabetes, I've also learned how to follow a sensible diet. That is important, as well as taking proper dietary supplements, to make sure you have enough calcium. And of course I have pain meds to manage the pain, which is mostly more acute at nighttime. I just want to preface all this by saying, and again, for those of you who don't know or are just new to the channel, I'm not a doctor. I am not medically trained. I am merely a cancer patient who wants to get as much information as possible about my condition, and then I can help maybe you guys so that you know what questions to ask your oncologist or your doctors. Does that sound fair enough? So sclerosis of the bone. Now I also have to say sclerosis can come in your hands, it can come around your heart, your kidney, liver. There's many kinds of sclerosis, so it's not just a one pill handles all kind of thing, okay? Sclerosis of the bone is a hardening of the bone. It's a sclerotic lesion, and it causes an uncommon thickening of the bone. Now, this can affect any bone, and it can be benign or malignant. It can be very slow growing. And previously, people that were diagnosed with breast cancer or prostate cancer, because it can be in the males also, had, when the tumors had gone into the bone, and then these sclerotic lesions had started forming, the life expectancy previously was 6 months to 48 months. But with the aforementioned development of the drugs and the combination of drugs such as the Ibrance and the letrozole and the bone infusions and, MRIs and CT scans with contrasting dye, it's made it so that it's manageable better. And so your life expectancy can be better, which, that's a good thing, right? So as I've said, there are many kinds of sclerosis. Everything from multiple sclerosis to sclerosis where it hardens around the heart, hardens around the kidney. But today I'm only going to talk about my sclerosis, the sclerosis of the bone. And if you need any more information, you can read Dr. Google till the cows come home and get yourself scared silly if you want. Sclerosis can be singular, one, or multifaceted. Now, my case, years ago in 95, when I was diagnosed with multiple sclerosis, over the years, the pain in my left hip grew more and more intense. Because at that time, my left foot wasn't moving, it was stiff, and I was swinging my leg out from the hip in order to walk. Now, sclerosis can be caused by underlying conditions, but also by age, simply by age, right? And so sometimes it can be misdiagnosed. And by misdiagnosed, it's also easy to ignore those little pains that are going on. And so really, you know, guys, I've talked to you before about working with your doctor, talking to your doctor honestly. It doesn't mean that you're, oh my God, I'm a hypochondriac, every little pain. No, it means that you're being a detective within your own body and making sure that you get the proper care, appropriate care that you need for what ails you. So in my case, I got diagnosed in July of 2021 with metastatic breast cancer. It had gone into my bone, and there was a hard and soft tumor on my right hip. Okay, that wasn't good news, but I knew something was up. And it was me that called the doctor and asked to have a complete blood work and CT scan done. Because, you know, we were still in the throes of COVID, and it was up to us to ask. And my doctor asked me why I wanted a complete CT scan done. And I said, there's something not right. I was raising my leg with my yoga strap, and I felt a little pop inside my body. It wasn't a noise, but I could feel that something had gone wrong. And I could choose to ignore it, but I knew in my heart that it wasn't right. So I called him. The CT scan discovered the tumors. So I asked, then why the heck am I getting all the pain on my left hip and my lower back? And in fact, my family doctor thought that my L3 and L4 on my spine, that the tumors had gone there, and also onto my left pelvis. But on speaking with my oncologist, she got a feeling that because of the low growth rate on these lesions, and the fact that my markers and everything were kind of in the right realm that she wanted them, she said, we're going to keep a close eye on them, but I have a feeling that what you have on your left pelvic area is sclerosis. So as I get older and I get weaker with the cancer and the MS, these lesions, or the thickening of the bone, is getting more intense. The lesions are putting pressure on my lower spine, which in turn is affecting the nerves. And I think I'm getting inflammation of the nerves, because all of a sudden my pain, which was always around the hip area, is now transferred to the left buttock and down the back side of my upper thigh. And that's just been in the last couple of months. And I'll tell you, it is debilitating. I can't even begin to explain how much pain it gives me at night, even with pain meds. So if during a CT scan with contrasting dye, they discover that these sclerotic tumors are indeed malignant, then one of the courses of action is to hit me with another heavy dose of radiation in that area, and hopefully that'll slow things down a little bit. So because sclerosis, I've explained before, can affect other organs such as your heart, your bile duct, which is right above your pancreas, and your kidney, there can be misdiagnosis, and that's why I'm telling you, you gotta keep in touch with your doctor. So besides medication, you should also have a diet that's rich in dark leafy greens, low in sugar, almonds, walnuts, calcium-rich foods, mild, gentle exercise. And by that, I would say you have to use your own judgment or work with a physiotherapist or your doctor to do what's right for you. Because you could do light weights or stretch bands. If you're a walker, you could walk, not run. But try to stay on a level, flat surface so that you don't have a chance of twisting your ankle and falling, because with the bone hardening and getting brittle, you do not want to fall. So whatever it takes to keep you stable is what you have to do. And no more jogging, and just use your common sense and keep in touch with your primary care physician. Now I'm going to kind of switch direction a little bit, sort of all in the same genre, but I'm going to talk to you about the sacrum. So when my cancer was diagnosed, the tumors had gone into the sacrum, and I had no idea what that was, so I had to, me and Mr. Google had to have a little session. But here's the thing that's really interesting. I've been doing a lot of research on the subject, not to find a miraculous cure or anything like that, but just to get information in my head so that I know what's going on in my body. And what I found was lower back pain can be misdiagnosed really quite easily unless you have an MRI or a CT with contrasting dye. So the sacrum joint attaches to the large pelvic bone, and that is known as the ilium. I'm going to try and keep it, pare it down a little bit to simplicity. The joints that connect the sacrum to the ilium are called the sacroiliac joints. And I may be mispronouncing this because, remember, I'm not a doctor. The SI joint or sacroiliac joint counts on strong ligaments to cover the joint, and these ligaments compress and stabilize the joint. So SI joint pain develops when these ligaments become damaged or degenerate, and that can be with aging. And one of the ways it can present itself is in lower back pain. Now, I don't know, but practically everyone I know in my age group or even younger has suffering from lower back pain. And we just deal with it. You ice it, you heat it, you're careful, you mildly exercise, you might have to take pain meds, whatever. But sometimes that can be a misdiagnosis. So that's why, I keep harping about keeping in touch with your doctor. You know why. So the reason I'm kind of going, this is so important, underline, listen to me, is because the pain in my lower back started presenting in the last couple of months as a pretty harsh pain in my buttock, left side, and the back side of my upper thigh, like a burning sensation. And it hurts like hell. Mostly at night, but lately it also is hurting during the day. And I'm going to talk to my oncologist about that because I don't really want to be taking narcotic pain meds all the time. And during the day I'm not taking anything. So I'm going to ask her if I can take something that will stop inflammation, because of that pain, it's irritating that joint and it's inflaming the joint. I know that my cancer isn't going away. I know that there'll come a day when I can't manage it. I know all that. I'm not living in a cloud in the sky. I'm being very open and honest about it, but this video I wanted to make because there may be those of you out there are suffering from, say, lower back pain, and that perhaps it could be managed in a different way, that you won't have to have back surgery because it isn't actually your back. It could be sacroiliac, Jesus, I can't even say it, joint, SI, sacrum. Now, it's all complicated. It's all right around your lower back and all the nerves. And they get all, swollen. They could get infected, for that matter, too. And that's why you have to take care of it. Not just go, oh my God, I've got an ache in my back, but it's not going away and it's slowly getting worse. And it's beginning to be very debilitating because I'm having trouble walking and I don't want to exercise. And I think it's just easier if I lay on the couch and watch Netflix because I'm in pain. That's what some of you might be going through right now. Instead of being your detective, like I've asked you before, to be your own detective, right? Talk to your doctor, keep on top of it. My oncologist and I are going to have a conversation in a couple of weeks. Yes, we are. And I'm going to find out what's going on because I don't like being in pain. And I do not want to be taking opioids, narcotics, constantly, because what that does is makes me sleepy and it lets me sleep for a couple of hours, but it's not necessarily taking away the pain. It's letting me sleep through the pain, which is a good thing at night. But during the day, I want my faculties about me. I know that there's questions about ibuprofen and Advil and things like that can be harsh on the kidneys. So that's why I want to talk to my doctor about that, because I don't want to do any more harm to my poor body than God knows it's already going through. Because, I have to tell you in all honesty, my body's a fighter. With all the crap that gets thrown at it, it just goes, all right, I'll deal with this one yet again. But I'm going to be 73 next month, so I know that I've got to be careful, extra careful. if I want to spend time with the people that I love. So talk to your doctor if you have any concerns. Look up some stuff on your own if you want to just sort of educate yourself a little bit. But, don't take it all to heart because you have a medical professional who's spent a lot of years in school to learn this stuff. So don't go in and go, I think it's this, I think it's that, because this lady on YouTube says blah, blah, blah. No, you got to use your common sense, okay? Take care of yourself and be safe. And if in any way this information that I've given you today helps you, hallelujah, not a miracle cure. I have to tell you, when I got diagnosed, and they said I had a tumor of the sacrum, I had no idea what they were talking about. And people I talked to didn't have any idea what I was talking about either. I said, well, is that the pelvis? No, not really. Was it the lower back? No, not really. So you can see how easily things can go awry. As an example, when my second set of CT scans came through, my family doctor called me, wonderful guy, to tell me that bad news, my tumors had spread from my right pelvic area to my left pelvic area, my L3 and L4 of the spine. And I thought, wow, that's going fast. I better get my affairs in order. And I planned a trip with my girlfriends, one last trip, settled into the maybe short haul. Then my oncologist phoned and said, oh no, you're not responding as if it's cancer on your L3 and L4 and your left side. We think it could possibly be sclerosis, which in itself should not be painful. All of a sudden, I didn't have a death sentence. All of a sudden, I had a life sentence, and it was up to me how I was going to take care of my life. And luckily for me, I have a great family and support system around me. Please stay safe, mind your health, take care of yourself, and I'll see you in a couple of weeks. Bye for now. Love you.